Hello, my name is Malcolm Burgess. I'm a consultant cardiologist in Liverpool. I work at Liverpool University Hospital. I'm a general cardiologist and I have a specialist interest in echocardiography. Well, it blends the scientific element of medicine with the human element. And certainly we'd like to apply evidence-based medicine in cardiology. And for that reason, the specialty is attractive to me, particularly also because it has a significant practical side to it as well as the theoretical side. I was always interested in general internal medicine as a medical student, and of the different specialties within that sphere, I felt that cardiology was a practical specialty. It's a specialty with plenty of evidence in terms of how we practice and how we apply the information from clinical trials to help patients' management. I went to Toronto to do my elective in cardiology and kind of got hooked on the ECG at an early stage, and then that sparked my interest in cardiology. I'd say the challenges are more working within the system that we have within the NHS. So the more generic challenges, the job is a very fulfilling job on a day-to-day basis. We can make a huge impact on patient care, but unfortunately, sometimes resource allocation is a problem. And we're also dealing with an aging population. So sometimes some of the treatments that we'd like to apply can be difficult to apply in patients with complex conditions and an increasing frailty. But nonetheless, many of the medical advances in cardiology are applicable to elderly patients. So we can still do a lot for the older, frailer patients. I find that we can make a big impact on patient care based on the huge advances within the specialty over the past, even the past 10 years, but perhaps over the last 20 years. In the 70s and 80s, management of many cardiac conditions was quite primitive and basic. For example, heart attack management didn't have a huge impact on patients, but now, right through from coronary artery disease to cardiac rhythm disturbances, valve disease, been huge advances, and what we do now for patients completely it's completely different to what we could do 20 years ago, and we've seen massive impact on patient management and outcomes as a consequence. Obviously, patients want to have good quality medical care. They want to have up-to-date treatment according to the most recent guidance. Patients obviously also value a personal touch. They want to feel as though they're being prioritized in terms of their particular personal needs, rather than simply applying some sort of generic algorithm. They want personalized care to a high standard.